I'm Arthel Neville. Time now for Sunday House Call.
And I'm Eric Shawn, and welcome as always. Joining us, Dr. Mark Siegel, professor of medicine at NYU's Langone Medical Center. He's also author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And Dr. David Samadi, chairman and professor of urology at Lenox Hill Hospital and chief of robotic surgery. Good to see both of you, doctors.
Great to see you.
Great to see you.
Hope you had a good week.
Yes, we want to start with something amazing. There is a stunning report on diabetes showing that 29 million people in the United States now suffer from the disease. That's up from 26 million in 2010. What's more, 1 in 4 people with diabetes don't even know they have it. Dr. Samadi, I want to start with you. First of all, what's causing? It's an epidemic, I would say.
You said it. It's absolutely a real epidemic. We're losing the battle, unfortunately. We're gaining about 1 million diabetic patients a year. As you mentioned, 26 million in 2010. Now we have 29 million. But it's a silent killer because you may have diabetes without even knowing it. And that's the pre-diabetics that we're worried about. About 86 million Americans right now are pre-diabetic. What does it mean? Your sugar level is high, not high enough to be diabetic. And the way to really detect it is to look for the symptoms. It's important for a lot of people to know what the symptoms of diabetes are. If you go where you have frequent urination, you're constantly thirsty, you have blurry vision, if you have a cut or a wound and it takes a long time for it to heal, tingling at the fingers and toes and those kind of things, you should see your doctor. And what they should do is, besides that, your blood sugar, they should get what we call a hemoglobin A1c. This is a blood test that your doctor will get that shows the record of what your sugar level has been for the last 3 months, and called hemoglobin A1c. If it's less than 5.7%, that's normal. If it's over 6.5, Arthel, that's diabetics, and then we have to start treating you.
I want to grab Dr. Siegel's point on this story as well. I want to get back to why is this happening? I still don't get it.
By the way, I'm going to answer that in a second, but I want to emphasize David's point about that hemoglobin A1c. I check that on every single patient that comes into the office. Why? Because we have 1 out of 3 Americans, that's the 86 million, now pre-diabetic. Why is it happening, Arthel? It's happening because of all of our weight gain, because almost 2/3 of Americans are overweight. 1/3 are obese. You know why that works that way? The pancreas produces a hormone called insulin. We take in sugar. But the trouble is, the bigger we are, the more insulin we need. And that pancreas is like a motor going faster and faster. It cannot produce the insulin you need, and you get resistant to it after a while if you weigh too much. Now, as an internist, I have to look at the combination of diabetes and other risks, high blood pressure, high cholesterol. It's a perfect storm because people are at big risk for heart disease, for stroke.
But all of this seems to be leading to lifestyle and what we're eating as well.
Bingo. You got to exercise. You got to eat right. We have a problem with junk food here in the United States. We're eating way too much sugar. We're a sedentary society. If you simply get up and exercise every day, do some cardio, even if it's just walking, and you change your diet choices. David and I talk about the Mediterranean diet a lot. If you get rid of all the fats and sugars you eat,
But what's a Mediterranean diet? Nobody really knows. What is that?
Well, we talk about
salads?
It's fruit and vegetables, it's nuts, it's olive oil, it's sauces, it's fish. Not a lot of meats, not a lot of processed foods. You can even have a glass of wine occasionally.
I think what we have is the inherent problem in our behavior. This is a behavioral problem that we have. We're passing on this problem to our children. About 17% of children are heading toward diabetes, and we have a huge problem. Now, the age between 15 and 19-year-old is a group that's really on a rise with diabetic. And to go back to answer your question is it the chicken or the egg first? It's obesity causes diabetes, or diabetes can cause obesity and everything else, high blood pressure. And so what is going on is if you have a type 1 diabetes, your body, your pancreas is not secreting insulin. That's mostly in children, and that's a different type of diabetes. We're talking about the lifestyle diabetes. This is like in rich type 2 diabetes is really in rich countries where there's a lot of money. As a result, the food is cheap and you can eat a lot of this food. So as a result of obesity, Arthel, your insulin doesn't function. You may have it, but it's almost like a key and a lock where it doesn't really, the receptors won't work. And that's why losing weight and trying to get rid of that fat can help with treating the diabetes.
That can help treat it, that can help avoid it, but does it get rid of it completely?
Well, I want to talk about that distinction. I'll answer that in a second. I want to get that distinction clear. Type 1 diabetic has an autoimmune disease. It's genetic. Actually, both of these are genetic. But with autoimmune disease, it's not purely related to weight. With type 1, no matter whether you're skinny, whether you're fat, you still can have diabetes. Type 2 is related to weight. So your answer to your question is yes, I can prevent this. If I have a patient that has a high sugar and they literally exercise and drop weight, I have about a 20 to 30% chance of them never getting diabetes over the next 5 years. The Centers for
Can you get rid of it if you get it?
You can get rid of it if you get it. If it's type 2, by losing weight, by exercising, by changing your lifestyle, there's hope. You're not stuck with this. You can get rid of it.
And the reason why this is important, even if you don't get rid of it completely, the fact that it can affect your kidneys, it can cause kidney disease, it can cause peripheral vascular disease leading to amputation, it can cause blindness. Even if you don't completely getting rid of it, when you come in Dr. Siegel's office with a sugar of 400, by bringing it down to a closer to normal with touch of insulin, he can fix it for you so you don't end up having this systemic disease. $245 billion of the healthcare cost is going to diabetes. So start getting out there, start losing weight, exercise, watch what you're eating, and all this processed food that you have.
And when you're
is a cause
talking
of a
about
problem.
processed food, we're talking about things that you just pop
Fast
in the microwave
food.
or things
All of that.
you drive through and
Fast
purchase.
food.
I want to
That's
emphasize one point that David just made that is huge, which is a combination of lifestyle plus the medication when I need it. I once had a patient, couldn't get his sugar under control no matter what. Nurse whispered to me, no matter what you do, doc, he's still drinking that strawberry soda. And he goes to the candy cart. If we can't get the behavior to improve, we end up chasing our tail with more and more medication.
And that's why if you're over the age of 45, if you have family history or genetics of diabetes among African Americans, these are very high-risk groups, and they should be monitored on a regular basis. Don't let this go on, because the effect of diabetes can stay in your system for many, many years. And that's...
And you mentioned the age group, but we were talking about kids too. You've got a lot of kids running around. They're not out there running around like we did, playing jump rope or whatever you did when you were a kid. They're sitting at the computer, sitting with the phones.
When the parents go to these fast food restaurants and they're ordering all this food, the kids are following the same kind of behavior. And unless we really bring in, it's interesting because Mark did a segment about a year ago about some of these fast foods, McDonald's, etc. And I said, I promise you, a year later, they have not incorporated all the fruits and vegetables and apples that you talked about.
I have to go to a commercial break. I promise that's
one quick thing. One thing, we're going to talk about lunch programs in a few months. You know something? You can have all the lunch healthy choices you want, but the kids are still lining up and eating the pizza and drinking the soda. That's the problem.
It's also the amount of
food. It's about, I was going to say, it's moderation. Absolutely. Okay, we have to move.